歡迎大家出席今
Welcome to today's press briefing. We have on the stage two speakers, Dr. Zhang Shukwan, Head of Communicable Disease Branch, Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of Hospital Authority. Dr. Zhang will first give you an update of COVID cases. Good afternoon. As of last night, we recorded 242 PCR positive cases and 189 RAT positive cases. The total number of positive cases stands at 431. Cumulatively, in the fifth wave, 1.18 million plus cases have been recorded positive, including 744,488 PCR positive cases and 444,769 RAT positive cases. Of the 242 PCR positive cases, 67 are reported by the HA, 47 are reported by the Public Health Laboratory Service of the CHP, and 128 returned by private laboratories. We conducted host genome sequencing for 96 cases. None of them had the L452R strain. They're all suspected to be Omicron cases. As for today's cases, there are 16 imported cases, 10 are PCR positive cases, 5 are RAT positive cases. As for 7 other cases, they were 7 arrivals from yesterday, affecting 4 flights BR867 and SQ882, 1 case per each flight, and QR8783 cases and SQ8142 cases. And 9 other cases relate to early arrivals. They are detected on the 6th day, and also one on the 12th day. As for this case, the CT value is on the low side, so it is possible that it is a local case after all, because previously this case also tested positive when in another country. As for residential care homes for the elderly and for the disabled, we have not recorded any new homes being affected. As for homes that already had previous cases, we recorded 5 more cases. Just a moment. Let me correct. 5 cases involving 4 RCHEs and 1 RCHD. There is no case related to any staff member. As for schools, today more schools have resumed classes. We understand that some 600 schools have resumed classes starting today, and 19 schools have reported positive cases, including 14 by rapid antigen test and 5 by PCR. So altogether, 19 cases in 19 schools, involving 13 students and 6 teachers. For the 14 RAT cases, today's Monday, so 8 tests positive today, 4 tests positive yesterday, and 2 others tested positive on Saturday. They just made the report today. Now, out of the 8 cases reported today, 5 of them have not returned to school. That means classes have not resumed. As for the 3 others, they attended school last week. Regarding the 5 PCR positive cases, we ask why PCR tests were conducted. This is due to various reasons. Say, the building where the case resided was subject to RTD operation, or some cases had symptoms. We're following up on these cases, and for the 5 cases last week, they did not attend classes. As for death cases, the HA has reported 11 more death cases. which tested positive in the past 28 days. And in the fifth wave, 8,980 cases of deaths have been reported by the hospital authority. As for forensic pathologists, they have reported 7 more deaths, which belong to those previously deceased. They involve 1 female, 6 males aged 59 to 89, and these are death cases recorded between March and April. One of them were residential care home residents, and all of them had chronic illnesses. According to the autopsy report, their deaths were all COVID-related. Together with the 7 additional cases, we've recorded 69 cases of deaths outside of the HA reporting system, including 3 by forensic pathologists and also others reported by the Chinese University Hospital. Altogether, 9,054 cases. So the gross death rate at the moment is 0.76%, with the fatality rate being highest among the unvaccinated and the lowest among those with 3 jabs. As for the unvaccinated, the fatality rate is 3.03%. Those with 1 jab, 1.02%, 2 jabs, 0.16%, and triple jabbed, 0.04%. It shows that vaccination is very effective in guarding against COVID. So I appeal to everyone who hasn't been vaccinated to get jabbed as soon as possible. Dr. Lau will report on HA situation. Good afternoon. At the moment, we have 2,002 confirmed cases receiving treatment at public hospitals, North Lantau Hospital, Hong Kong Infection Center, the HA's Infectious Disease Center, and also the AWE treatment facility. Yesterday, 2 patients were reported to be in critical condition, 3 in serious condition, and 16 patients in critical conditions are receiving treatment in ICU so far. There are also 11 cases of deaths reported. They passed away in the past 24 hours, namely 5 males, 6 females, aged 72 to 95. For those who passed away yesterday, they were all above 65 years old. 6 of them were from residential care homes. 6 of them did not have vaccination record. 2 had 1 jab. So altogether, 8 or 70% of all the cases of deaths did not complete the vaccination program. 3 received 2 jabs. Yesterday, 139 patients have recovered, including 62 patients having been discharged upon recovery. In the 5th wave, so far 46,921 patients have recovered, and so far 59,301 patients have been discharged upon recovery, and there are also 6 patients found to be positive upon hospital admission screening, and 7 patients sharing the same cubicle are regarded as close contacts. As for HA staff, so far 22,266 staff members have tested positive, and 21,692 staff members have returned to work. The floor is now open. Please use a mic when you ask questions, and please introduce the media organization you represent. I'm from Now TV. Good afternoon. First, about that imported case detected on the 12th day, may I know the country of origin, and also, do you think that is a positive case, because you talked about having a positive record in the other country? Does it mean that the CHP is of the view that he is safe in the community and will not cause any infection risk? And about schools, previously it was said that with classes being resumed, you expect to see more and more cases. And in terms of risk assessment, can you tell us whether there are outbreaks in schools? And also for the 8 RAT positive cases, 3 of them returned to school before. So how high is the infection risk? And can you tell us whether they are from primary schools or which primary school?
The imported case was classified as imported case for now. On February 1st, the person came from Nepal, and the case was confirmed there. Later on, he tested negative. But now, on the 12th day, after entering Hong Kong, test result CT was 19 to 27. So that's the chance of a re-positive case. But there's also the chance that he could have been infected in the community. We have obtained his experimental sample and compare it with other virus strain. So far, we've classified it as an imported case. We want to wait for more detailed analysis first before making a final conclusion in relation to the virus strain concerned. I just gave details about the school cases. Some had not been back to school. Some went to school last week. There's one case. And last week, there was also a teacher who tested positive. But now we've seen student cases. And but they were from the same school, but they had not met each other. They were not in the same class. There are still cases in the community. For the positive cases, very likely that they might have been contracted the virus from their family members or in the community. As long as there's no outbreak in schools, then we continue to observe the situation. Chances of outbreak are not high now. This one? From cable. On the 12th day, the case which tested positive on the 12th day, the imported case, do you think it relates to a virus variant? Or is it possible that the case was infected in the hotel? Were anyone living on the same floor in the hotel were infected or classified as close contacts? And the pandemic has for 2 years has under 500 infection cases. Is it possible, like the experts say, we can, by 2 weeks later, we can relax further the social distancing measures? The case that tested positive on the 12th day, for each positive case, after confirmation in the quarantine center, well, I should put it this way, for each positive case, we would look at the whether there are similar cases in the quarantine hotel. We're still checking the information now. And we also carry out testing if needed. We haven't found any related cases yet, but we still need more time. What's your other question? Well, the government would monitor the pandemic and other factors before making a decision. Are those that one at the back? I'm from Mingpao. Dr. Chuang just now said that the latest 19 cases newly reported, any of them related to infection in school. How would you assess the risk of spread of the virus in schools? Just now you mentioned there are 3 students who tested positive from RAT. Were they from the same class or same school? Another question is, some experts today, like Dr. Ho Pak Leung, suggested that we can suspend the flight ban or suspension mechanism. What does HB consider that? Do you think it's appropriate to scrap the flight suspension mechanism? Have you tested in your testing, and have you found any new variants among imported cases? We haven't received from any of our laboratory testing staff that there are any BA.2 variant strain. We haven't seen it yet, but there are still other tests undergoing, but we haven't found any variant strain. For the 19 positive cases, they come from 19 schools. So far, we haven't seen any outbreak in schools, but still there are cases within the community. So as long as the student tested positive, do not return to school, and there's no outbreak in schools, then we'll just keep monitoring the situation. This one, please. Good afternoon. I'm from TVB. From May 1st, non-Hong Kong residents can come to Hong Kong, but they will need to spend 7 days at least at a quarantine hotel. The quarantine hotels now, the number more than 42. But for the quarantine hotels, do you think we have enough of them? Would you consider increasing their number? And also, I know that pandemic has stabilized a bit and case numbers have fallen, and we are having a phased easing of social distancing measures. Has CHB discussed with the government in relation to the vaccine pass? Would the vaccine pass be implemented, or would there be any criteria, or at what level would the requirement for vaccine pass be relaxed? I think vaccine pass is a good measure, so when people are out eating at a high-risk situation, if the diners have been vaccinated, then they'll be safer, relatively speaking. But of course, we're not talking about 100% protection. So I think vaccine pass should be continued. As for quarantine hotels, I think the relevant departments would monitor the usage rate and see whether there are any need for more hotels. Sorry, the speaker is not using the mic. Well, I don't have the figures you asked for. This lady here from Hong Kong 01. Nepal. The Nepal case who tested positive on the 12th day. Was it a domestic helper involved? And what about if it's a domestic helper? Was the employer infected? If not, then what about her family or his family members? Were they infected? And also, experts proposed today that now with the current state of the pandemic, which is quite stable, so people might not need to wear a mask when outdoors. What does the CHB consider that suggestion? Do you think that's feasible at this current level of the pandemic? Do you think that measure, not requiring people to wear masks, is possible? Yeah, that's it. Well, the case was not, you mentioned, was not a domestic helper. The person lived alone, so he didn't have any family members. We would look at the case again, see whether there's a re-positive case or a case of infection within the community. But of course, there could be other possibilities. We'll look into that as well. As for the social distancing measures, whether to wear masks, I think the government would continue to monitor the situation. If there are any new changes, policies to be implemented, they will let the public know as soon as possible. Next one, lady over there at the back.
现在想请问，就是本港已经连续11 位数。
The number has remained at 3 figures, infection number. So what are the people who are infected? What measures can be used to control the pandemic so that the number of infection could drop further? Another question is, there was a doctor who suggested yesterday that children aged 3 to 11, their vaccination rate has exceeded 65%, but that's not an ideal percentage. So children could be a high-risk group should another epidemic or another wave occur. So what would you suggest that how can we overcome the bottleneck of not enough vaccination rate among children?
位数。
At the moment, we have a 3-digit figure of confirmed cases, but we need to continue to observe social distancing measures and pay attention to personal hygiene. More importantly, we need to get vaccinated. Vaccination is the best way of reducing severe cases and guard against deaths in this COVID pandemic. As for vaccination rate for children between the age of 3 and 11, I understand that the government has been making an effort to further boost the vaccination rate for this age group. Next. I'm from Economic Times. More about this Nepalese who test positive. Is there any vaccination record? You mentioned that the case tested positive on the 1st of February in Nepal. Do you have record about the mutant strain involved? And when did he come to Hong Kong? When did he complete the quarantine? And will the CHP conduct contact tracing to find out about close contacts? And as for the school concerned previously, a teacher also tested positive. Does it mean that the school now has 2 cases recorded? And did they return to the school on the same day? And starting from the 23rd of April, it seems that the mandatory or the compulsory testing requirement only applies to those who stay in the premises for a shorter period. For the Nepalese, he tested positive on the 1st of February, but there is no information on which substrain he contracted, BA subtype. So we will consider whether he's an important case and whether there is any epidemiological link with local infections. He arrived in Hong Kong on the 12th of April. As for the school, you mentioned, indeed, we've recorded 2 cases involving 1 teacher and 1 student. One of them tested positive last week. We made inquiries. We understand they didn't have a lot of contact. And the fact is there are still transmission chains in the community, and it is no surprise if a school records 2 positive cases. But of course, we'll continue to keep in view the situation and see if there are other related cases. After all, schools are required to undergo daily testing, and it will be easy to identify outbreaks. As for compulsory testing, the incubation period for Omicron is shorter. The typical incubation period is one of 14 days, yet we wish to identify high-risk groups. So those who stayed in the premises 7 days before the indicated date are the high-risk individuals, and they should be subject to compulsory testing. He has no symptoms, and he received the 2 BioNTech jabs. The last one was administered on the 9th of April. So let me check. Let me correct. He received the 2nd jab in 2021. He had 2 jabs, the last one being administered in 2021 in April. The last question, please. I'm from Orange News. Good afternoon. Schools have gradually resumed classes. The vaccination rate for children between 3 and 11 is only 65%. Do you think that it provides sufficient safeguard? And according to experts, the vaccine pass cannot effectively increase vaccination rate, and the experts have advised making the vaccine pass requirement more stringent to boost the vaccination rate. What is the government's take on the suggestion, and do you think that the vaccine pass is effective in boosting vaccination? Of course, the vaccination rate among children between 3 and 11 is not satisfactory. We do hope that when children resume schooling, they should have been jabbed before. And of course, you cannot build herd immunity by having other students receiving the vaccine instead of yourself. The point is, vaccine seeks to reduce infection and also to protect yourself, because after all, if a children is contracted with the virus, he may have a lot of complications, and the case may become severe. And according to doctors, it's been recently discovered that there might be inflammation of different organs of the children if he's infected. That is why we appeal to parents to help the children get jabbed, so that even if they are infected, there won't be complications or severe symptoms. As for vaccine pass requirement, the experts' recommendation will be considered. That's the end of today's briefing. Thank you.